What's up, YouTube? I am Robert Linkul with Training the Older Adult, and welcome to another how-to episode. Really, what we're going to talk about today is what is carpal tunnel syndrome and how do you either prevent yourself from getting it or improve your abilities if you do have it. We'll talk about surgical options. We'll talk about non-surgical options. And just so you're not like, who's this guy and what's he talking about? We're going to reference one of the more credible sources out there. I will take you through their short video and showcase the symptoms, the causes, the fixes, and some of the things that we can focus on to help prevent it as we move forward. I have had 3 surgeries on my hand and or wrist, and we'll be sharing and going through some of the experiences I had, some of the exercises that I used before surgery, after surgery, and then some of the strength training strategies, fascia release, and therapies that I've used to help improve my blood flow, my range of motion, and all that. So we'll take you through all this one step at a time. Hope you enjoy this. If you have any other questions, be sure to comment below. Remember to subscribe, ring the bell, and make sure you don't miss any of our content that we put out. Try to put out at least one video a week for you with some good information. All right, let's dive right into it. Carpal tunnel syndrome, here we go. All right, team, so here we're going to dive into this website here is the American Association of Surgery of the Hand. And this is their landing page here for carpal tunnel syndrome. Kind of takes you through some of their explanations of what it is, the causes, some of the symptoms and such. And they have a video here that's going to take us through the surgery. I am going to warn you, it is rather graphic. It's completely the real thing, and they show them cutting this person open here. So I will give you a little warning before we dive into that, but I will share with you and discuss some of these options as we go through. We'll also, oh, here we go, how to combat prostate issues. We're not going to talk about that one. Let's close that out. Different treatments and non-surgical treatments, surgical treatments, etc. So let's dive into this first little bit here in discussing what the symptoms are, what is this, and what kind of issues do we experience. So basically, carpal tunnel syndrome is it's a pressure and collapse of, if you will, a tunnel in which all the nerves to your hand run right through the opening here of the hand, and they will run through out into the fingertips and extend. And what happens is either with many years of us utilizing forward flexed positions, typing, gripping, forward flexing, etc., over gripping when exercising, or if we do any kind of physical hand labor type movements, shovel, snow, raking, anything like that, where you're over gripping, overusing your hands and collapsing that bit of the wrist, we'll start to experience some of these symptoms, which we'll talk about here in just a minute. Another very common area of employment that leads to this is any kind of groundwork. I used to lay tiles during the summertime, and you would have one hand on the floor holding your weight while you would trowel and work, put down the tiles and put in the grout and everything else that we would do. And my hands would be numb. The pressure that I would put through my hands would start to create a lot of these symptoms that we get. So there's a lot of pressure and overuse injuries, and or one very traumatic experience. If you were to fall and brace with your hands, and the impact from the ground into your hand could definitely cause some issues on there too. So the symptoms that we're going to start to experience are going to be tingling and numbing through the hand. Basically, it affects, for most people, it affects the thumb, the index finger, the middle finger, and then it can affect the ring finger, as you see the little image here, kind of half of that ring finger as we go through. It's rather unlikely to get down all the way into your pinky unless you've had some some non-typical, I would say, injuries or effects to it. The causes, then we'll get into some of the symptoms. as you can see, it's arthritis, gout, infection, tumors, ganglion cyst, which is one that I had. You could have a fracture, impact from the fall, or just massive repetitive movements of work, homework, groundwork, over gripping, etc., as we talked about earlier. With the symptoms that you're going to start to experience, the numbing in there, it'll definitely be worse at night, as you'll see in the video. If you're sleeping in these positions, which we have the ability to naturally kind of go to when you're sleeping, you get into the fetal position and you'll see your hands will start to kind of curl up, the wrists will start to curl up, your feet will do the same, everything kind of collapses in. And when we sleep like this, we have any kind of REM-based experiences where you're twitching, reacting, responding, you'll have a lot of flexing, a lot of forward gripping, forward flexing of the wrist can cause that pinch off of the nerve, and you'll wake up with your fingers all tingly and numb and they hurt. You'll also start to experience some issues or some discomfort at the wrist. You'll have issues with the strength in your hand. You'll start to feel weaker with your ability to grip and hold on to things. You might drop more objects, and just to have overall discomfort and aching at the hand and the wrist for the majority of the day, if not all the day. So this becomes extremely painful and annoying, meaning that it's kind of nonstop. It's always something that you're experiencing or feeling unless you're in just the right positions. And there isn't a whole lot to do to combat it in the moment. You can obviously take anti-inflammatories or painkillers. Obviously, we don't advise that, especially not for the long run, maybe for flare-ups or some small issues that come about. But really, that is not the answer. So as you see here, anti-inflammatories, medicines, they'll do some steroid injections. And those injections I had, and they're 50-50 in my opinion. Some of them worked, some of them did not. I've had maybe 10 to 15 steroid shots in my life between my hips, my back, my wrists. And I would say half of them actually worked well. I got more relief from some with the numbing gel and the numbing injection they gave me for 2 days. And then when that wore off, the steroid component to it really kind of did nothing. Other times it worked great. So really it's kind of 50-50. They do have wrist splints that you can wear that hold your hand in just the right position when you're sleeping or even through the day, that tries to keep that carpal tunnel neutral, and it just brings extra support and attention to your wrist being in the right positions. The problem with this is as soon as you take them off, you're going to go right back to your regular habits. So you're either going to wear these wrist splints or these braces permanently, literally even while you're sleeping. You take them off to shower, you put them right back on for the rest of the day. So you basically constantly have these braces on, which will lead to other atrophies of the hand, the wrist, and the forearm, because you're not moving or utilizing the musculature in there all that well when you have this big bulky wrist brace on there. So what a lot will do is they'll wear the braces at night. And I did that for a while, maybe up to a year. Not the most romantic thing I would say is to have these big bulky Velcro vests or wrist braces on your wrist. And the Keegan's hair would get stuck in it. Like, we would have all kinds of issues just moving around in bed at night, let alone anything of the romantic type. Let me take off my braces here real quick. It got annoying. It got old. And after some period of time, it didn't actually even work all that well anymore. So there's some things that you can do there that I think might give you some relief, might help out a bit. I'm going to show you in just a moment some of the therapies that I've used in-house. I work with my current clients on some massage therapy, some scraping, some cupping techniques that will definitely help. And these are things that you don't have to have a physical therapy degree in to do on yourself, and you do not have to have a referral to a doctor to do them either. So we'll dive into those in just a moment. But I will tell you that a lot of these home strategies and home techniques that you can implement can and will give you some relief. And just depends on the severity of the case that you have. If things improve and get better and your quality of life is improved, or it might be too late. And if it is, then you're going to have to look at some surgical procedures. So before we look at surgery, let's dive into some of the strategies that we can do in-house here with you to help improve your pain and range of motion issues at the wrist. Okay, gang, so I've got a bunch of different things laid out here. Basically, a quick review of what everything is. These are Iron Mind Captain of Crush grips. Now, mind you, with carpal tunnel issues, we don't want to do a whole lot of gripping and overdeveloping of our wrist flexing and grip strength necessarily. What's going to help us more in here is extension of the hand, extension of the wrist to try to open up and help free up the space in our hand. So we're going to only use these post-surgery. You can get all the way down to like the entry level, which is like a 40 or a 60 pounder. And it's just going to help us like gently rebuild some of our gripping strength. But outside of post-surgery, we're not really going to use those a whole lot. These are the Iron Mind rubber bands. I really, really like these. They're much easier to get on and off than some of the other ones where there's an individual, rubber ring around. These are easy on and off. You can put them where you're most comfortable and just work through, sets of 10, 12, maybe 15. They do come with instructions that discuss doing like, one set of 10 every day for a week and then kind of gradually increasing, because if you don't do a lot of grip strength or hand strengthening exercises, this can be a little aggressive to start. And obviously you start with the white one, your little weight, and kind of work your way up. Okay, some of the more aggressive therapies that we could discuss is scraping. I have two different tools here. These are from the company Sidekick. This is the Eclipse, I believe, or no, this is the Eclipse, and this is the, I forget what this one's called. But both of these guys are great tools, so I'm going to show you a couple different scraping techniques. And then cupping kits, very good support for cupping in terms of increasing range of motion, flexibility, and treating some discomfort. I used both scraping and cupping prior to my surgeries, through and after rehab, and then in between each surgery as well. And both of these were fantastic tools. The reason that I am sharing them with you today is because they worked so well. I enjoyed it so much and knew it was beneficial for me. So I went out and learned from Dan, our physical therapist, on how to do this to myself. And then with months and months and even years with the cupping now of practice, I am capable and able to do this with my clients. So these are tools that you can purchase online. They're not terribly expensive. The Sidekick tools are basically about $100 for each one. They have a variety of different tools that you can pick from. And then cupping kits will be anywhere, basic ones that are just little push-ons for $10 and up to a little bit more of an advanced kit like this one for maybe $40 or $50 to $100 kits that have tons of different cups that are all, molded, and they have different kind of curves and edges on them so they can fit in more comfortable positions, that kind of thing. So we'll dive into all that here in just a second. First, let's talk about the scraping techniques. So what scraping does is it increases blood flow, number one, in the area. It does help in kind of loosening or reducing any kind of tightness or stress inside a muscle. It's very good for pre and post workout to increase the blood flow to the area. It does help break up some fascia in a sense of if you have any type of small amount of scar tissues or just tight sore muscles, and increasing the blood flow and moving the fascia around to help stimulate the rehabilitation process or the regrowth process post-workout. So it's an aggressive form of massage, if you will, that you can do with this. Now with the forearm, the way that we want to treat this, you take some of your gel. This could be any type of lotion or oil or gel that is comfortable for you. Just make sure that you're not allergic to it. You apply that to the arm, and then your tool of choice, I like to use the more open and kind of softer edge to start off. And what we're going to do in the beginning with the forearm on the inside is I'm just going to start with my tool at about 30 to 40 degrees on my angle here, and I'm just going to kind of start working through some ranges of motion. Now there's nothing really that you're specifically attempting to to break up or move. You're just kind of moving through the musculature and trying to increase the blood flow, stimulate the muscle a little bit as you work your way through it. And as you're doing this, you're going to start to feel some things in the muscle. You'll feel them. It feels like gravel, like if you had a little piece of pebble underneath your skin and you could feel it go boop, 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 and you could rub it back and forth. That's what we're looking for in some of these areas. And when you feel that, you want to just work through those. This is not a deep tissue massage. This is about stimulation and about applying some pressure to where you can feel it, but more is not better, is basically what I'm trying to say, okay? Depending on what we're treating here, there are some advantages to, say, more proximal to distal application in the beginning. Again, we're just kind of getting our arm used to the idea of what we're doing, right? All right, now we're ready to get a little bit more aggressive with our treatment. You are going to see I'm starting to turn red a little bit. That's okay. If it starts to turn purple or it starts to get bruised afterwards, that means you were a little bit too aggressive in your treatment and you pushed too hard. This is a learning process, so go easy to start, and you could always increase this as you go. So now I've turned my tool around, and to start off here, I am going to go a little bit more from my proximal end to my distal end and just start to work through my muscles here a little bit more, kind of pushing and encouraging this blood flow, this stimulus here as I work my way around. Now, because I'm using the more blunt end or the more aggressive end of the tool, I'm definitely feeling a lot more with this, okay? And again, if it feels like it's too much, feel my little crunchies here, I can start to kind of work through some more of the meat. Notice I'm not crossing the joint, okay? So I'm not going over my wrist. I'm trying to stay away from my artery and my veins that kind of stick up. Just staying more into the meat of your arm, if you will, and kind of work through this with a little bit more of an aggressive or a little bit more pressure as we kind of get in here. And we're just going to target all the way around. Now, the reason that we're treating both sides of the arm and not just the flexor side to work on our carpal tunnel is that I want improvements with my extensor strength. The stronger I get on the back side of my arm, the better I'm going to be at relieving pressure on the front. Think of your hand and wrist as a pulley, okay? Well, what we do so much through our day of texting and typing and gripping and steering, our pulley is so dominant on this side, we need to try to neutral it out by working the back side of the arm a little bit more. Now I'm going to go back to my softer edge and just maybe get a little bit more aggressive in here and kind of finish up my treatment and work my way through. Again, going easy on those sensitive areas. And that is pretty much it when it comes to the stimulus there for a little bit of scraping. Now you can be a little bit more aggressive in some of the areas, more in the meat down here with your medial side, on the pinky side, the ulnar side. If you want to do that, it's up to you. You can get a little bit more aggressive up in here. This also is a very good treatment to use for medial and lateral epicondylitis, tennis elbow, golfer's elbow, so it can help quite a bit with that, all right? So a good treatment for us would be to scrape and kind of work this and get it feeling good, and then we would cup afterwards, okay? So with the cupping, I'm going to take one of my bigger cups and I'm going to work here on a little bit higher end, again, below the joint. I want to just be in the good meatier aspect of the arm. I'm going to do 2 pumps on this guy, and everybody's going to be different on what they can handle. If they want, I'm going to move this down just a little bit. If they want 1 pump, 1.5 pumps, 2 pumps, it just depends on what your tolerance is. And again, more is not necessarily better when it comes to these treatments, okay? Now we'll talk about the purpose of cupping and what it is that we're trying to achieve with this as we kind of work our way through. And I'm going to get one more here on this side. Again, I'm trying to avoid getting too close to the wrist, getting into the more shallow end of my artery and my veins in my wrist here so I don't cause any damage. Okay, so that is my inside treatment, and then I like to do one more on the top. This is something that I kind of developed myself where I feel like there's a greater benefit to have both sides. Sorry for the technique here. It's much easier if you have both hands and someone's doing this to you. So I just put a little bit on the back side here. Now, what we're working on is getting our epidermis, our skin, to suction and pull up. After that, we will have the subdermal layers, the adipose tissue, your fat, and then eventually your muscle. As I continue to wait a couple of minutes and I allow this to allow the pressure inside the cups and I kind of relax, I allow my tissue to start to pull up. Think of this as my wrist flexors, let's call it 15 inches in length, right? Well, I can work through a range of motion and stretch them a bit, but I can't get a ton of range of motion because my wrist can only go so far. So what I could do is hook under the muscle and pull it up to stretch it. Okay, so envision this being my forearm. Basically, I can get under it and stretch it by pulling it up. So that's more or less what we're trying to do here, is put suction on to where it's going to pull our skin layer, okay, and then our fat layer, and then our muscular layer up into the cup. But if you're resisting and fighting it the whole time, it's not going to do that. So you've got to just kind of relax, allow the pressure to apply. They put little lines on here. You can see that ideally you get it to the first line or maybe midway. If you're getting anywhere towards the top of these cups and you're on your forearm or areas where the skin is thinner and you don't have as much skin, it can be a little bit too aggressive, okay? So go gentle, very easy to start off. Once I get these guys on here, I'm going to start working through a little range of motion to allow the muscle to go on slack when I flex and get sucked in a little more, and then I can extend through here and kind of pull that musculature back out against the suction and then allow it to pull back in again, okay? And I'm just going to work some range of motion here. This was the one that gave me just a ton of relief with my carpal tunnel syndrome and my issues I was having, my numbness, my tingling, and just kind of working my way through here, okay? And you'll feel a little bit, you just heard it squeak a little bit, like some of these you'll work through some ranges and they might pop off or they might, change in tension a little bit. That's okay. Just kind of work through. This shouldn't take more than 4 or 5 minutes at the most. And then when you're done, you can undo. And if you want to do a little bit of gliding, you can do some gliding. I'll show you that here in just a second. And then we're going to come back and do a little scraping to finish it off, okay? So I'm going to take off a little bit, let the pressure out. Oops, let it all out. Put this guy back on. You noticed I did like 1.5 pumps. So now I'm just going to do a little half pump, okay? Just to get enough that it'll stay on. And then I can start to work this guy across the area that I just did. And basically the suction is pulling up. And as I do this, it's not terribly comfortable, okay? But it's working that musculature underneath there and kind of pulling it up and working through some range for me, okay? I can take my scraping tool and just go back through. A lot of this action afterwards, either with the tool or just with your hand, is just to kind of make the area feel okay again, because it can be rather intense to have that pressure on there. So we go through and just a little rub, and then I might come back over it again and just kind of rub these guys and just make them feel a little bit better, kind of get that blood flow moving. Okay, now you're going to have some marks. Marks are okay. If you have really deep bruising, it was too much. But I'm going to be a little red, and I'm definitely going to have some little rings here as part of my treatment. But that gives you a very good example of how we can treat. I have to do it on my left arm because I'm right-handed. I want to show you guys what we're doing, but how I would treat my carpal tunnel issues that I was having on this right side. So if surgery were to come about, rehabilitating back from that, I would continue with some light scraping up in here. I would continue to work my extensors. This is after you've been cleared, of course, to be able to do these things. Your stitches are out, and the doctor says you're good to go easy, nothing over 15 pounds of grip, that kind of thing. And just kind of start back lightly with some of your grippers, maybe a little pinch grip, some very light carries, and so on. So your tools, your choices, things that we have to go through here. Remember, we are not rehabilitating, we're not diagnosing any issues. We're basically working on areas that are weak or that are limited in strength and trying to get them better, and then treating other areas where I'm lacking, having some discomfort, And again, if you have any doubts or any concerns on how to do this, talk to a professional, make sure you learn how to do it, and definitely don't do it to anybody else until you know exactly what you're doing. You're either certified or signed off to be able to do this. We implement some of these and you practice them for a while and things improve, then let's keep doing that and hopefully we have a breakthrough. But if not, we're going to have to look into some type of surgical procedures. Again, this is where your doctor is going to come in. You need to go through all the proper steps. Start with your regular physician and maybe get a referral to see a hand specialist. From there, they'll be able to take you through and do some nerve tests. They hook your hands up and to all these little electrodes, and they send all these little signals, and some of them will really hurt and some of them won't hurt at all. And basically going through that test will tell you how severe of nerve issue you are having and if you are a good candidate for this surgical procedure. So I'm going to show you this video, but let me give the fair warning. This is it's a little graphic, and if it's a little bit too much for you, I encourage you to kind of look away. I have a hard time stomaching some of these things, so not the best. I could never be a doctor, but
definitely.
Here we go.
Not being able to hold anything like a needle and thread. I wanted to hem a shirt that had come apart, and I couldn't hold the needle. And it would fall out of my hand. These two, the two middle fingers.
Yeah.
Carpal tunnel syndrome is numbness and tingling in the thumb, index, middle, or ring fingers. It's caused by a ligament pressing on the nerve below. Yeah. It often awakens patients from sleep,
See the wrist,
if you
how
sleep
they're all
with your
kinked.
wrist flexed.
Yeah.
Wearing a splint at night helps keep your wrist straight and often helps. Steroid injections can help, especially in mild cases. With time, the tingling may progress and occur during the day. Surgery is indicated when symptoms progress, splints or injections no longer provide relief, or there's poor conduction on nerve studies.
Yeah. Nerve study is good. That helped us a lot.
We'll bring you into an operating room and make you comfortable. We'll clean your arm.
Comfort is good.
Place sterile drapes and numb the skin.
Oh, geez.
We'll make an incision, identify the ligament pressing on the nerve, and protect the nerve below it. We'll release the ligament, close the skin, and apply a soft, comfortable dressing. An open carpal tunnel release is shown here, but the ligament can be released through a different incision with the assistance of a camera, endoscopic carpal tunnel. Both techniques can provide relief from the symptoms of carpal tunnel.
I'm very pleased with the outcome.
For more information on this and other disorders of the hand, wrist, and elbow, go to www.handcare.org.
There you go. Okay, so so gross, man. The surgery works great. It has a 96.9, I believe. I'll look that up before we move on here. But I believe it's a very, very high success rate. And if it's not higher, it might be 99% success rate. Success rate for carpal tunnel release surgery. We'll check that out here real quick live. I should have had this stat ready to go for you guys, but 90%, it's well over 90%, very high success rate of over 90%. Many symptoms quickly relieved after treatment immediately, including tingling sensation in the hands and or waking up at night. This was October 22nd of 2019. This is the clevelandclinic.org study that looked at a review of those surgeries. So over 90% success rate, almost immediate relief. Mine was instantaneous. Now I had a ganglion cyst the first time that had ruptured. It was pushing on my nerve. I had a carpal tunnel collapse, and I had a ligament for my thumb that had torn or had some damage to it. It had not torn just yet, but had some damage to it. So the first surgery I had removed the ganglion cyst and did some restructuring or rebuilding to that ligament to try to help. That lasted for about 8 months. The cyst came back. The nerve pain in my hand was even worse. And the ligament issue, I was still having a lot of thumb strength issues, and it wasn't basically even close remotely to equaling the grip strength that I had on my other hand, which was not necessarily my stronger arm, stronger in carrying stuff, but not in terms of my grip strength through the dynamometer and such. So the next surgery we had, it was a carpal tunnel release, a ganglion cyst removal, and they thought that would be enough. They had to go back in a third time and then repair and do some more work to the ligament on my thumb. So I've had the carpal tunnel right here down the center. You can actually barely see my scar now because they put it kind of right in the crease of my hand, which is nice for them to kind of hide it there. And then you can see the big surgical scar here of this guy that I had down this side. My issues moving forward after the surgery are practically none. On rare occasion, I'll have little tiny tingles here and there, and it's usually if I'm on the ground playing with the kids, I'm in a push-up position or 6-point position for long periods of time. So I think you're going to be able to feel pretty good relief from it. I will tell you this, if you guys have ganglion cysts, and if you look it up, there's like the old wives' tale of you could hit it with a book and that will, please don't do that. You cause way more damage. And if it's anywhere near an artery or a vein, hitting it with the spine of a book, which I've had many people tell me like, oh, I did that as a kid. My parents told me to do not do that. If you hit that artery, especially an artery, and it punctures or bursts that artery, you could have serious issues. Now, mine was right on top of my artery coming into my hand here. And if I had done that, it would have really caused some damage. So please don't do that. Go in and see your specialist, see your doctors, start with some physical therapy, see how things go. And if it doesn't work and you're still having, you're doing your braces, you're doing your medications, if that's what you choose to do, and we're still not having that, then I would look into the surgical options, as I feel like they have done a ton for me. And you can see over 90% of the folks that have that surgery experience, a much greater and much improved quality of life. Now, basically, there's a little transverse-based ligament inside the hand that is the other side of the tunnel, if you will. They cut that just to relieve all the pressure into your hand. And the negative to that is you can have some pain, some achy pain in your hand, but if you rebuild the strength in there, that goes away. Mine went away in a couple of weeks. Some people will last up to maybe a year or so. And if they don't rebuild or if they don't work the strength back into their hand, it could last longer or be permanent. But if you rehabilitate and go through all the steps that you're supposed to, I think for most people that will go away. The two fat pads in your hand, you could see when they were cutting that hand open, you saw the stuff that looked like little white bumps, and that's fat. Now you have fat pads in your hands here. And I'm not saying you have fat hands. I'm just saying you have two fat pads. We all do in the hand there. Those fat pads need to be featured when you're doing any kind of bench pressing or floor rowing or anything where you're placing a weight in your hand. Instead of allowing the grip and the bar to pivot down the center of your hand, it should go across in your grip. So really make sure you're securing and keeping that carpal tunnel opening free when you're gripping onto, I'll use my little tool here. When I'm gripping onto a dumbbell, it should hold like so, not like that. Okay, you guys see how I've got that like pivoted and it's down the middle of my hand as opposed to square in my grip, leaving that carpal tunnel pressure area open. Surgery worked great. Symptoms have been good. Ganglion cysts do have a high return rate. Arthritis is something that you cannot get rid of, but you can improve. So hopefully through surgeries and your therapies, you're able to improve your carpal tunnel and or hand wrist pain. A lot of the other injuries that might cause this via a wrist fracture or some other type of accidents. Again, you're going to do the best you can what you're working with. Without knowing more specifics, wouldn't be able to tell you the higher success rates of that. But this is one of those procedures that you can bounce back from and pretty much return to a high quality of life, a normal quality of life, if you do the therapy that you need to do. A lot of people think, it's a little minor thing with my hands. If I just kind of start using them again, it'll just go back to normal. It's not really the case. If you really want to maximize your potential and get yourself back or make yourself even better than you were, you need to rehabilitate this just like anything else. There's no such thing, in my opinion, as minor surgery. Anytime you are put out or even twilighted and a surgery and surgical procedure like this is done, it's a big deal. You're having your skin opened and something cut or removed or repaired in your body. It's a big deal. So take it serious, do the rehab, get the work, and hopefully on the other end of this, you're either just as good or better than you were the first time. So any questions, any comments, feel free to comment down below, and I will be glad to give you some answers, point you in the right directions. I will post the links not only for the stats that I just got you from the Cleveland study there, but also from the video that we just watched. Hope you all enjoyed this, and thank you very much for being here and spending some time with us. I am Robert Linkul. Go to trainingtheolderadult.com if you want more information. Remember to sign up for our website. And on this YouTube page, please share, please click to subscribe and hit that little bell in the corner so you get your alerts. You won't miss any of the content that we put up. We appreciate you all. Thank you so much. And our motto, always remember, movement is life. Get out there, get your work done, and improve your quality of life. We love you guys, and we will see you next time. Take care.